which is public hearing consideration of revised County of Lake ambulance ordinance and ordinance amending article. Somebody help me with that.
4 or 9.
9.
Article 9, Chapter 9 of the Lake County Code pertaining to permitting an operation of medical transportation services, continued from December 17th, 2024. And we have our health services staff, Mr. Eichelman, here to present.
Good morning, Supervisors. My name is Dean Eichelman. I don't know if you can hear me. My name is Dean Eichelman, and I'm the Emergency Preparedness Coordinator for Health Services. And thank you for the opportunity to present this agenda item to you today. On behalf of our Health Services Director, Anthony Arton, we are seeking your support in approving a revised ambulance ordinance which was last updated in 2004. This ordinance addresses permitting for public and private provider ambulances, establishes the permit processes, permittee standards and regulations to follow, and defines interfacility transfers as well as Priority 1 transfers from our base hospitals for patients needing higher levels of care outside of the county. The Lake County Emergency Medical Care Committee has reviewed this ordinance and has voted to move this forward for your consideration today. I would be happy to address any questions you may have. Thank you.
Thank you, Mr. Eichelman. Before we open it up to the public, I see Supervisor Pyska. You have the floor.
I have a question about the fees. They're not explicitly laid out in this ordinance, and then I followed up with Director Arton. Also, I don't think that they're in our master fee schedule too. So I was just wondering where those are and what you can add.
Yeah, thank you for the question. So you're correct. They are not currently in the master fee schedule for the county. And those are something that I believe our department would need to bring to you to get those adopted into our master fee schedule. So unfortunately, no, that is not in our current ordinance. It's not in the old ordinance either. It's stated the same way.
So what are the fees then?
There is no fee set right now at this time. That's something that we'd have to bring back.
Supervisor Sabatier,
I believe CAO Carter might have a comment.
CAO.
Assistant.
ACAO, sorry. Acting CAO.
On regards to that, we do an annual master fee update in May, and we have already been in contact with the department. The fee will be part of the study and put in the May update to take effect July 1.
Have there been no fees?
Correct.
Okay. Do you have an idea what the recommendation will be on fees?
Unfortunately, I'm not able to comment on that. That's something that our department will review and come back to you with.
Okay.
There'll be a study done.
Sabatier.
There'll be a study done. Okay.
And I think that it's the right order of operations. This is a very antiquated, old version of an ambulance ordinance that really needed to be revised. There's multiple reasons why it needed to be revised. That was one of the reasons, but without getting the approval today, there was no need necessary to work on what we were doing. This also stems from, granted it doesn't solve the problem, but this stems from some of the problems we were enduring of outside of county ambulance coming into the county. This really separates public and private. This also hopefully will help out with some of the IFT problems that we've been enduring for decades here. And what this does also, which is one of the kind of the line in the sand that we were not willing to cross, was to protect our 911 system for our local agencies, to make sure that they kept control over that and that it did not eventually go into the control of some of the private ambulances that come into the county. So I appreciate all the work that's gone into this. It's taken quite a long time. I feel that this has already led to some of those changes to our IFTs, as we're seeing hospitals looking at contracting with ambulances specifically for that process. for their patients. And so I think that we're seeing some progress here, and this is one of the big pieces to the puzzle to make sure that we have oversight of those ambulances that come into our area. There were some public comments that were provided, and I can't specify all of the comments, but I know there was some concerns about us glossing over some of the mandates on our public agencies. Those public agencies already have the mandates through state law. They already have to go through their process to make sure that their rigs are permitted and allowed for use. So there's no need to replicate state law into our local agency ordinance. What we did was just add the specifics to the private ambulances that would get permitted to do the work here in the county. I know there was also some comments about some of the people that were involved. We have the North Coast EMS. They are a vital part of the operation for our LEMSA here in Lake County. They definitely had a review process. There was quite a number of folks from Sutter, from Adventist, from fire districts, from public health, and others that were involved. And I know there was a mention of conflict of interest, but the doctor specific from North Coast EMS is not a member of the EMCC, and this was voted on by the EMCC to be brought to the Board of Supervisors. So I do not believe that there is any conflict in the process that has occurred in order to bring this final document to us. So I just want to at least speak on behalf of some of the comments that I received.
Any other supervisor comments? CAO?
So I did get confirmation, the previous fees were $150 per permit, so it should be around the same amount this next time.
Thank you for that. Hearing no other supervisor comments, I will comment. I'm comfortable moving the ordinance forward with knowing that the fees will be reviewed when the county does a master fee schedule study, and that will come back and we'll be able to see that. I know there's been a lot of work done on this through the Emergency Medical Care Committee, the Fire Chiefs Association, and others, and it's something that I think we need to move forward. So hearing no other supervisor comments, I'll go ahead and open it up to the public in the chamber. Are there any members of the public that wish to speak? Chief Cepeda, you'll have 3 minutes, yeah.
So thank you again. As Brenda was saying, that ambulance ordinance goes back to the early 80s, revised about 1988, again in 1997, and then again in 2004. So on March 22nd, 2004, at 2:15 in the afternoon, the local provider pulled out of the county. They called the fire chief, said we're deceasing operations. And the fire chiefs got together, and March 22nd would be our 21st year of doing this. So the old document was convoluted because we had to the county had to sort through issuing a permit, or what the fire chiefs did is we wrote mutual aid agreements to them, allowing them in there. Since this document, it does split the hairs. It allows autonomy for the IFT program, which we totally support. We do and are involved in the priority ones where we downstaff a 911 car for those life and limb type of situations. But it gives them some autonomy to do what they need to do to fulfill those interfacility transfers. The document, I would say we have several 200, 300, 400 hours into it over the last 2 years. But it does provide and segregate that public-private sector. We are exempt from Title 13. Our inspections, our personnel, our ASC certified mechanics, every day there's a pre-inspection, pre-trip on the equipment that we operate. Work very closely with public health and all different assets. At one point in time, we operated about 24 911 fire-based EMS ambulances. We're down to about 18 now. We are the only county in the state of California that's predominantly fire-based. The last private provider we had, which is where the fee scale kind of come into, is there wasn't any providers, and they were in here on mutual aid, whether it be Falk, AMR, the different ones. Right now, Adventist does have a contract with the Ukiah Valley Fire Authority. Chief Doug Hutchinson was the chief at Lakeport. He's the chief over there now, and they're fulfilling those. And I think that probably eats up my 3 minutes, but thank you for your time. And Bruno, thank you for all your support. Dean, all your support. The chiefs and everybody that spent a lot of grueling hours, coffee and donuts to make it happen. Thank you.
Thank you.
Thank you, Chief. Any other members of the public in the chamber? Seeing none, Joanna, do we have any hands in Zoom? Hearing none, I'll bring it back to the board for consideration.
Mr. Chair, I move to approve the revised County of Lake Ambulance Ordinance and Ordinance amending Article 9 of Chapter 9 of the Lake County Code pertaining to permitting and operation of medical transportation services.
And,
I second that.
Mr. Chair, if I may, as part of that motion, your board may want to consider to be read in title only, and just, yeah, I understand that Supervisor Sabatier already pretty much read it in title, but upon approval of that motion, the clerk can then read the title of the ordinance.
I move to approve the ordinance read in title only.
I second that.
Have a motion and a second. Call for a vote. All those in favor, say aye.
Aye.
Aye. Opposed? Nobody opposed? A call for a vote? Or, I'm sorry, we already did.
Upgraded.
No. Oh. Okay, so it's an ordinance amending Article 9 of Chapter 9 of the Lake County Code pertaining to permitting and operation of medical transportation services. There you go.
And Mr. Chair, if I may,
Yes.
I make a motion to move the second reading of the ordinance to the following meeting.
Second.
I have a motion and a second. All those in favor say aye.
Aye.
Aye. Opposed? Nobody opposed.
And just for clarification, Mr. Chair, if I may, that next meeting would be February 25th, 2025.
Thank you.